Okay, thank you all for joining us today. My name is Mary Nelson. I'm an Employment and Economic Wellbeing Policy Associate here at APHSA. We're very pleased to be hosting today's presentation on improving economic stability for young parents and their children. I'm going to take a moment here at the top to provide a brief overview of APHSA, give some content on young parents, and also to introduce our presenters before handing it over to them for the main presentation. We'll be facilitating a Q&A at the end of the presentation, so please feel free to drop your questions in the chat. For those of you who are not familiar with the American Public Human Services Association, we are a bipartisan nonprofit membership organization, and we represent state and local human services agencies throughout the country. We also house communities in multiple health and human services disciplines, whose members are the administrators that operate health and human services departments in state and local governments. These communities include our membership of SNAP directors, TANF administrators, child welfare administrators, chief information officers, and others. You can find additional information about that on our website, in addition to links to our social media and signups for our weekly health and human services analysis emails. What we, as well as our policy members and stakeholders, really aim for is to work together to influence modern policy and practice, to build knowledge and capacity in the health and human services field, and to connect members through our conferences and learning opportunities such as this session today. Before handing it over to our main presenters, I wanted to take a moment to provide a little bit more information about young parents and families as a population. Nationally, there are approximately 3.4 million children under the age of 5 living with parents who are between the ages of 18 and 24. Young families are disproportionately live in poverty or near poverty, and particularly youth in foster care systems are susceptible to becoming young parents. Young parents also have higher utilization of important health and human services supports than both their older parents and young adults without children. This is important to note because this session today is actually part of a series of 3 sessions on supports for young parents and families. This is our second session, and in the first session, we were able to hear from representatives in Georgia about how they are supporting youth transitioning from the foster care system. Those youth are often simultaneously entering the front door of other systems, including SNAP, TANF, and Medicaid. And since we know that young parents and families are leveraging these systems for support at a disproportionate rate, it's imperative that the structures underpinning the systems are based on accurate and meaningful understandings of the population's strengths, opportunities, and barriers, including incorporating youth voice and effective feedback and evaluation tools so that young parents are given the best opportunity to achieve economic stability and mobility for themselves and their children. Today's session will focus on this aspect of supporting young parents and families. Before moving on, I'd like to touch a bit more on young families and their strengths. Young parents often face obstacles such as commonly face obstacles such as disruption in education, joblessness, access to quality childcare, inadequate or unstable housing, access to comprehensive healthcare or mental health services, and a lack of parenting experience or supports. While they may experience greater obstacles than either older parents or their childless peers, they also have the capacity for incredible resilience, creativity, and hope. For young parents and children, they are both entering a critically important developmental time described as 2 open windows. While the child is rapidly developing from infancy to age 3, forming relationships, learning language, and creating new neural connections, young parents are also developing skills as adolescents, the skills that they need in order to be successful in work, school, and parenting. Now, during this stage, when parents learn, they're able to reinforce what their children are also learning, and this ability to reinforce what's being learned motivates parents to continue to succeed. Research also shows that young parents often desire to be good parents and maintain high ambitions for themselves and their children, such as financial independence, quality and affordable housing, good jobs, and a secure and safe environment for their families. With that overview, I'm excited to introduce today's speakers who will share examples of their work to build programs that better support young families. I do want to mention before diving into introductions of the speakers, that the presentation today primarily will discuss TANF-funded programs. However, I believe the lessons learned from these examples are versatile and can be incorporated into a variety of economic development program strategies to support young parents and families. Today, we are joined by representatives of the Kentucky Division of Family Support, Jason Dunn and Aaron Kidder. Jason has over 30 years of experience working with major public assistance programs in the Commonwealth, including TANF, SNAP, and Medicaid eligibility. Jason's primary goal throughout his career has been to help Kentuckians and their families to their fullest potential. Aaron Kidder is the TANF Public Assistance Program Specialist for the Division of Family Support's Policy Development Branch. Prior to working at the central office, she began her career with Kentucky state government as a frontline worker at the Family Support Office. And she's been working in the Commonwealth for 11 years. Aaron has a Bachelor's of Arts degree from Transylvania University. We are also joined by representatives from the Massachusetts Department of Transitional Assistance, Kamaria Moore-Hollis and Tyrese Thomas. As the Economic Mobility Manager, Kamiria oversees several of DTA's employment services programs, which focus on 2-gen outcomes that support economic mobility for DTA clients. The majority of her professional career has been spent developing innovative strategies to help families gain economic mobility. As the Assistant Director of Employment Services, Tyrese oversees the largest employment training program, leads employment-related TANF initiatives, and analyzes and evaluates TANF policies and procedures to make changes to impact and improve the lives of families served. She joined DTA in 2013 and has worked in human services for 20 years, including 14 years in state government. We're also pleased today to be joined by our moderators for the rest of today's presentation and our partners from Third Sector, Joelle Stracker and Miranda Beggins. Third Sector is an advisory service firm that provides technical assistance support to human services agencies at a state and county level. They have worked closely with Massachusetts and Kentucky teams through the national cohorts that help public agencies better serve families with an increased focus on outcomes. Now I'll turn it over to Joelle to share some background on Third Sector's efforts before turning it over to Massachusetts and Kentucky's speakers.
Thank you, Mary, and many thanks to EPHSA for hosting today's session. Can you hear me? Just confirming.
Yep, you're good.
All right, awesome. I would also like to thank the Kentucky, Massachusetts, and Third Sector teams for all the efforts that went into preparing and planning for today's session. For those, next slide please. For those of you who don't know us, Third Sector is a nonprofit organization that provides technical assistance to state, county, and community agencies to implement systems change that link public funding to the achievement of meaningful outcomes. We work with dozens of partners across the US to help them better use data to design, implement, and improve programs, facilitate stakeholder engagement efforts to include new voices in service design and evaluation efforts. We help to bridge silos between public agencies serving the same organization. Some of our engagements have helped agencies launch outcomes contracts in partnership with or using input from providers and communities that they work with. Outcome contracts tie payments to specific outcome goals for priority populations. To date, Third Sector has supported state and local agencies to deploy over $800 million in public funding through these types of contracts. Our approach to supporting partners is to work with them to embed an outcomes orientation into funding, policy, and program decision-making, with a specific focus on changes related to improving stakeholder engagement, establishing measurable goals for programs, and implementing systems of continuous improvement. We work across a variety of issue areas, including children and families, education, health, homelessness, justice, and economic mobility. Next slide, please. In supporting state, county, and community agencies, we have found the cohort model to be a useful approach. This approach allows us to support agencies, several agencies at once, to work on a similar population, issue area, or funding stream, and for those agencies to connect with and learn from each other. Economic mobility is one issue area that states are grappling with across the country. It is also one issue area that we have had major cohort work in over the last 5 years. Here are 3 examples of sites from our current and past cohorts that have continued to shape our understanding of how to better use public funds to support economic mobility outcomes. Our work in Kentucky comes from our most recent cohorts, the Southeast Cohort on young parents and families. This cohort is comprised of 3 sites that are working to enhance and align programs and policies, as well as systems to better support young parent families. Our work in Massachusetts is from a previous cohort called Empowering Families. This work was funded by a federal grant that supported a cohort of 6 sites to develop programs and systems to advance 2-gen outcomes for families. Our work in Northern Virginia was also funded by a federal grant and was part of our early cohort efforts. This cohort brought together 5 sites to strengthen youth workforce development programs across the country. You can find more information on our work across these cohorts on our website, thirdsectorcap.org. Today, we are shining the spotlight on 2 sites, Kentucky and Massachusetts. These sites share a focus on a common priority population, young parents, and primarily use the same funding stream, TANF, to support that population. I would now turn it over to my colleague, Miranda, who would facilitate a discussion with representatives from these sites. Miranda?
Great, thanks, Joel. So just quickly before we kick it over to hearing directly from our friends in Kentucky and Massachusetts, I just wanted to provide some additional context around the goal of kind of bringing these 2 agencies who work on TANF programs. And I think what we wanted to focus on was highlighting the different strategies that both the Massachusetts Department of Transitional Assistance and the Kentucky Division of Family Support have taken to advancing economic stability for young parents. And so we'll draw out some of those different strategies in our next conversation. And so what we'll do first is hear from our friends in Kentucky. And so what I'll do is I'll turn it over to Jason Dunn from Kentucky DFS to give an overview of the work that we've been doing through the Southeast Cohort on young parents.
All righty. Thank you. As Miranda said, I'm Jason Dunn. I'm the director of the Division of Family Support in the Department for Community-Based Services. So we have responsibility for the major public assistance programs, SNAP and TANF, and we do some Medicaid eligibility and other small programs. I have to give my little bit of a disclaimer that I joined the agency, I rejoined the agency in April of this year. So this work was already well underway. So was the pandemic. So it was something that, aside from stepping into an already rushing river, this was a lot of work that was already going on that's very planful and very future oriented. And I'll admit it was hard for me to get into because we had so much else going on at the time. But once I did get into it, I was really pleased with the direction things were going. I do want to talk about our partnerships that we have. We have our division that does the policy and procedures and regulations and writing reports and things like that. And then we also partner with our DCBS Division of Service Regions, which oversees the work of the field staff. So, very vital partner for us, clearly. And then we also have the Kentucky Center for Statistics, generic name, great agency. They used to be called the Kentucky Center for Education and Workforce Statistics. So, we can we can send a file to them, and they can help us, you know, see what kind of education and employment outcomes we're seeing for our, excuse me, for our TANF participants. So we really focused on self-sufficiency outcomes for young parents, you know, building on a continuum of care and prioritizing some life outcomes a little bit more so than we had in the past. So through that, of course, we needed that engagement with both the frontline staff and with the young parents that we're trying to serve. Next slide. So, you know, question one, the priorities for advancing self-sufficiency outcomes for young parents. I think in the way this will work for our next few slides, I'll kind of hit on these major themes, and Erin will help me fill in the details because Erin's been here since the beginning of all this work, and she's much more into the details than I am. But she'll probably disagree. But anyway, you know, the two big themes we want to look at: shifting from outputs to outcomes. We've been output oriented for a very long time, probably since TANF came around. And you know, how do we, not to say we have bad outcomes, but we want to make sure that we're aiming towards one and not the other. And then shifting to a human-centered design approach to the way we deliver services. That's something we're trying to do in multiple facets of our work, and we want to certainly bring that into our work with the TANF families. Erin?
Hello, everyone. I think a lot of this project in the beginning was really about looking at our agency's culture. I think data collection and long-term outcomes are just something that for an agency that deals with things like food stamps and cash assistance, you're just trying to keep your head above water, and it's hard to think about long-term futures. So just looking at a culture change and really looking at the way we collect data and the way we try to plan long-term, you know, was something we definitely focused on in the beginning. I also cannot emphasize enough how much this project has helped us as far as, you know, focus and between different agencies during the COVID crisis.
Mm-hmm.
Thank you, Erin and Jason, for giving that overview. Just wanted to pause here and really kind of reiterate, you know, a couple of the points that were mentioned here. So, you know, just to kind of bring everyone else along here, you know, I think this project has really been focused on, you know, thinking about the young parent population in, you know, the TANF Works program, which, you know, is really focused on, you know, building those employment and education pathways for TANF recipients. And so, you know, a lot of what we've talked about and worked on in this particular engagement has been really building a process of you know, prioritizing those long-term outcomes as Jason mentioned, and really making sure that there's data to support those and to leverage and the delivery of services, but also thinking about kind of this human-centered design piece that Erin mentioned, and really just kind of bringing the human touch and the engagement component back to this work. And I think, you know, engaging with frontline staff and hearing from their experiences and some of the challenges that they've faced in engaging with this population has been really, I think, informative in determining kind of what the path forward will look like and how the work will look moving forward. So just wanted to kind of highlight, you know, a little bit more of that context here. But I think we can jump to the next slide here and kind of get into some of the details on kind of what that engagement with frontline staff has looked like, and you know, what were some of the learnings from that, and kind of how is that changing how the agency is thinking about the work that you all do.
Yeah, so a lot of it's interesting that some of our key learnings are similar, both from our feedback that we received from frontline staff and feedback that we received from some of our participants. It was really cool to see that both kind of see some of the same issues, maybe from their own perspective, but ultimately it's the same kind of issue. You know, frontline staff not having enough time to do real case management. We have a disaggregated business model right now, where we have folks who work on the phones, folks who process cases, that we still have case managers who should have the time to be able to serve folks with case management services, but that sometimes doesn't happen. We are so focused on meeting participation rates and not making errors in our cases. Those don't always equate to outcomes. You hope that they do, but they don't always necessarily equate to the best outcomes. And frontline staff wanting more support, both from a policy perspective from the Division of Family Support and from a management perspective from the Division of Service Regions. I'll turn it over to Erin again.
I think that, we had another project with SNAP ENT that involved human-centered design last year. And so involving the TANF programs in, 2019, 2020's projects has been very exciting. I do think that we've gotten incredibly positive feedback from our field workers, specifically our case managers, who aren't, these are the people that are seeing the clients, but we're often not asking for their opinions. And I think the baseline of human-centered design is you ask the people that are doing the program what they want to change about the program and what they think the problems are, or maybe what's working and needs to be expanded. So I think that inadvertently over the last 5 years, through our integration of a new computer system, the creation of a call center, all these things where technology is supposed to make our lives better, in some ways they absolutely do make things better and allow our elderly populations and other people to access services. But in some ways we've lost the human touch. We've lost that face-to-face case management experience where you have someone who knows the most sensitive issues that you face, such as domestic violence and other things. And so, I think we've identified some of those problems. Trying to figure out how to manage them over the phone due to COVID is definitely going to be a future challenge. But I have a lot to say. So Miranda, if you want to have anything.
Yeah, no, I think that's super, super helpful, Erin, to hear some of those reflections and those learnings. I would love to hear a little bit more of kind of some of the conversations that you all are having at sort of the leadership level, kind of hearing all of this feedback from frontline staff and thinking about how you all are responding and shifting things in response to that.
Sorry, I was muted. I think we're in phase 1. So, we're still in a lot of data collection right now. We're engaging the staff who are they've been thirsty for this for a long time, wanting for management, upper level leadership to listen to their concerns, specifically related to case management in the TANF program. And, I think they're excited about that. We're excited for them on that. So we wanted to, I think we're still a little bit early in that stage. Melissa's question in chat about the activities staff engaged in, right now we're engaging in conversations with the staff to hear what their issues are. And that's what a lot of this work has done. We'll show some of the results from that, and then, how we want to make next steps from there.
Great. Thanks, Jason. And so, I know on the next slide, if we want to jump there, we also, got feedback directly from young parents. I think the frontline staff engagement at this point has been more extensive. And so I think there's been more to pull from that. But I think, that's been another focus here. And so we'd love to kind of hear the, similar responses based on the learnings from the young parents themselves.
Yeah, and I think a lot of this, a lot of the themes that we heard from the participants is directly related to that human-centered design, which I consider human-centered design just to be a public policy version of the golden rule. Doing, for others the way you would want to be treated if you were thrown into a system that you didn't really know how to navigate and function. What kind of direction would I need if I'm put into a system I don't know anything about? So, so those themes came through here with, being able to access their case manager. If we want to build that trust, they need to have that access and that ability to reach out and to be comfortable enough to share some things with their case manager when we don't necessarily have that face-to-face opportunity all the time. And the rest just goes along with that. Communication, respect and understanding, and understanding the policies, what they're supposed to do. I think all of that is part of that human-centered design, recognizing what parents are facing, recognizing what kind of communication they need, and being able to navigate this system. We need to make that easier, I think.
For me, for question 3, I think a big thing for the young parents, a big piece of this project for me has always been the supportive services and the underuse of supportive services, somewhat due to a lack of knowledge on both the clients and, to be honest, the workers. Just because we have quite a large base of younger workers that maybe are unfamiliar with the wide range of services we have available, some of the less common supportive services that are underused. I know Miranda, we had some surveys and focus groups and different things, but I know the surveys specifically with the parents, we discovered that some of our assumptions were accurate about transportation was being used, car repairs being used, but a lot of these services are just, I think we have an opportunity if we were to utilize some of the services for supportive services more, that it will lead to things like diplomas and jobs. And so I think it's about getting the word out, training our workers to market that to our client base. And I really taking that feedback from what services the young parents have used. It's helpful.
Yeah, and I think the aspirational quotes that you see here, really do reflect the population that we're serving. We have been an agency that has been focused on educational attainment since the beginning of the TANF program. I mean, it's written into our state law that, we're going to support people in education as much as we can. We have the Ready to Work program with our community and technical college system. I know a couple of them are in the meeting, so I want to give them a shout out. But we recognized early in this state that there was a need for educational support because we were a low education attainment state, and still in many ways are. So this is, we have great tools in our toolbox. We want to be able to sharpen those and focus those to be able to use them to get the best outcomes.
Yeah, I think that's really great to highlight. I think especially, Erin, your point here around kind of the underutilization of supportive services. I think what we saw was that there's services related to education and employment and additional benefits related to kind of connecting folks to a job and kind of overcoming some of those initial costs that they might have to kind of pay to be able to start a new career or a new educational pathway. And so I think that was something that we definitely learned. I think one other thing I want to kind of reiterate around kind of the relationship between this feedback gathering process with frontline staff and young parents and kind of how that connects back to thinking about the outcomes that are kind of coming from these programs. I think the conversations that we've had kind of in response to this feedback is things like an employment outcome is not necessarily good or bad unless it's actually supporting a family and kind of contextualizing some of those outcomes that I think we traditionally see as that's the goal is get folks back to work. And I think that's still the goal, but it's also looking at all of those other challenges and additional needs and additional supportive services that are kind of necessary to go hand in hand with, you know, that work actually coming through. And so just wanted to kind of reiterate that point as well. And, you know, I think the conversations that we've had coming out of the focus groups and survey have also reiterated how this work is informing the path forward and the strategies that you all are really thinking about as an agency, you know, beyond this project itself.
Miranda, I'd like to add one more thing for the people not from Kentucky on the call. Our Ready to Work program is a program that it is a job that is also associated with the network of community colleges in our state. I'm sure you all are aware with the federal requirements of the 12-month VOC limit for educational components. And so we are able to allow our Kentucky Works program participants to continue staying in school, but they get a work study job at the school. So they're able to earn some money that is not counted towards their KTAP case and continue to stay in school while they are on a TANF program. So I think that you know, I realize there are some people from Ready to Work on this call. So, you know, I can't say enough nice things about Ready to Work and it being efficient to helping people.
Great. Thank you, Erin. I think with that, I think we'll transition over to the Massachusetts case study here, and we'll have an opportunity to hear from the Kentucky folks again when we bring the folks together. But I'll turn it over to Tyrese to talk a little bit about the work that they've been really doing to center families and really, you know, increase flexibility to support outcomes achievement for young parents at DTA.
Thanks, Miranda. So welcome, everyone. So Massachusetts, our story is an interesting one because it actually started with us looking at the low unemployment rate. And we really looked at that as an opportunity for us to really be able to move families closer to economic mobility. We are the public benefits agency in Massachusetts. So we administer SNAP benefits, TANF, and we also provide benefits for elderly and disabled. It's actually like a state level of a disability benefit. We have 22 local offices across the state, and our local workers are responsible for eligibility and engagement. So we have a worker that actually just doesn't determine eligibility. On our SNAP side of our house, they are a first available worker model, so they actually are not assigned case management. But on our TANF side of the house, it is pretty much driven by a case management model. So that's a big difference in Massachusetts. Our employment, we have employment specialists in all of our offices. It ranges for about 1 to 2 in each office, and they're mainly responsible for supporting our employment and training programs. And so that's just like a high level of what our agency does. We're not broken up into districts or provinces, as in some other states. We actually cover the entire state. So where did things start for us? It really started for us with really thinking about the way that we look at our families and the way that we process eligibility. In our state, our workers are very much compliance driven. So a lot of the work is completely driven by eligibility, often leaving out any opportunities for employment and work, or really promoting employment and work. So what we actually did, we took a shift in our system to really move to thinking about people, right? Like people and human touch, and what does that mean? And that really pushed us really thinking about engagement and how could we make some improvements in our programming. And so it shifted us really from this compliance-driven model, focused on holding like providers accountable, and really focused on clients' butts being in seats, but not actually looking at were they really engaged, right? And were they really trying to move past just being present in a program, really to like an outcomes-based system. And so we really took the opportunity to
make some adjustments in our procurements. And so we were re-procuring, our first program that we were re-procuring was our Young Parents program. And so there we took the opportunity to really move to a human-centered approach that focused on meaningful engagement and goal attainment, not just for the individual client, but for the entire family, right? We used this opportunity to really prioritize outcomes goals and align incentives to results rather than service models. And in support of that, we had 3 main goals, right? To provide individualized, flexible, right? And when we say flexible, allowing for some level of failure, because we know that will happen when life happens. And then our second goal was really to track meaningful outcomes. And what did that mean? It wasn't just in necessarily education, but also in their life, right? What's happening in their life or in their family that was related to their outcome. And then we would pay for 2 gen outcomes achievement that maintain high expectations. And the last thing was really to really think about, sorry, I'm losing track. And our last thing was to really think about how our programs will work with the entire family. So not just focused on the education outcome, but an education to career pathway that would really address everything about the family. Kamari?
Hi, everyone. I think we can move to the next slide to show the question. So just to echo Tyree's sentiments, you know, we were really undergoing a large organizational change at the time. You know, this focus on compliance over engagement was inherent through our staff, and through our programs, our program providers. We contract out with local community-based providers to provide these services for all of our employment and training programs. And this sentiment was really focused in a lot of their programming. So it was a shift, a large shift that we had to make to get folks to adjust from compliance to engagement. And it's a shift that's still happening, and I think will continue to happen. So I think the motivation to change, you know, alongside everything that Tyree said was, you know, part of this organizational shift was really looking at data and utilizing data to make effective changes in our organizations. And one of the things that really stood out for us was that we saw that 50% of our TANF recipients were also part of a TANF household when they were children. So we recognized that we really were not making any changes to move folks out of poverty. If anything, we were moving them further into poverty. So we wanted to focus on that first. We also had opportunity. So we had the re-procurement was coming up for a young parent program. It hadn't been re-procured in 10 years, so it was pretty outdated. We also had some new leadership at the time. Our associate commissioner had come from DCF. She always says that it was several months before she heard somebody mention a child at our agency. So we were not focused on children at all. We were focused on the compliance of the head of household in our case. So we were presented with this opportunity for a procurement. We were already moving kind of the agency into the direction. So we wanted to use the young parent program kind of as a guinea pig. You know, previously before the procurement, we were very, like Tyree said, we were very focused on participation and how many hours were you actually participating. We were getting outcomes, but they were not quality. Any employment that we were getting was kind of low skill and low wage. So we wanted to focus on improving those outcomes. We also already had a large employment program. So, you know, we took this opportunity to change what we were looking for desired outcomes for this program. We shifted them completely to education with the understanding that, of course, young parents may have a need for employment at that time, but there are other resources that they can access. For this particular program, we really wanted to focus on gaining higher education. And I think we can move on to the next question, unless you wanted to jump in, Miranda.
No, I think I'm good. Go ahead.
So the next one, how did we increase funding flexibility for a family-centered approach? So part of that procurement, we made a lot of different changes, actually. One of them that I didn't mention as well was we increased the age that families were able to access the program. It used to be until 22, and we increased it to 24. Part of that was to align with other young parent programs statewide. You know, I'm sure other states can recognize this, that there's so many, you know, there's so many different entry points for young parents. So we kind of wanted to align with the majority of other young parent programs that we had. So the main thing that we did was we changed the contracts to be outcome based. So we're trusting that we're trusting that our clients and our families know what's best for them, and that they can make decisions based on what goals they want to pursue, and that the providers working with them are, you know, they've been vetted through us, they have access to the best technology, the best research, and they can help our clients get to that place without us interfering. So essentially, we are paying for high quality outcomes, and we are allowing the client and the provider to get there, you know, between each other. It also allowed us to, you know, like I said earlier, though, before this kind of organizational change, there hadn't been much talk about children. So these outcomes allowed us to focus more on not just the two generations. So, you know, the idea that if you're supporting the child, if the child is getting better outcomes, the parent is going to get better outcomes, but also the whole family. So anyone who's really part of that household, we wanted to support. So we were able to open the majority of our employment service programs to non-custodial parents, so that not just that head of household is able to access our programs. And even if that non-custodial parent is not on a TANF case with us, they're still able to access our employment and training programs. It also, you know, finally, I think one thing that it allowed us to do was to change who the young parent was that we worked with. I think previously we were so prescribed to this participation that some community-based providers who were well known in the community and did a lot of great work felt uncomfortable being restrained to the rules that we had, because their clients were so non-traditional, and a lot of them were not, you know, they were not actively seeking services. The providers, you know, it was a lot of folks who were gang involved, or you know, just a lot of different families who are not generally our traditional young parents. So we were able to bring in a lot more of non-traditional providers through that way. So I think that's the end of my spiel.
Thank you, Kamaria. I think that point that you made around, you know, the fact that the flexibility actually, you know, enabled providers who, you know, wouldn't have typically, you know, looked for funding through the Young Parents Program to be able to, you know, really thinking about that from an equity standpoint to just increasing the kind of inclusiveness of the program and making sure that more folks can benefit from the services that are coming through YPP. So I think that was a great thing to highlight. I think we can jump to the next question here, which is really just thinking about kind of what's come since the contract and kind of the stakeholder engagement and relationship building pieces that have followed.
So what I will say is, like, re-procuring our young parent program was like a great thing, in that we were really thinking about how our providers will work with our clients, and how and we expected them to be intentional with working with not just the client, but their entire family. But we had to bring our system along with it, right? And in that, we didn't always think about how does that impact everyone else, meaning our central office staff, our local office staff, like, what did that mean? And we really, the shift brought us to really realizing that I call this the Trinity. Everyone laughs at me at work, but I call our little triangle our Trinity, because it really speaks to about how all parties, like all three pieces of the Trinity, really have to be working collectively for clients to really be successful and to reach the outcomes, right? And so the biggest shift for us is we really had to do an assessment of the way we work with the providers, right? And how would we be able to do that? So we really had to be thoughtful about what our communication pathways look like and what our expectations were, right? We were asking providers, we allowed providers some flexibility in how they would get clients to the outcomes. And we were like, we'll give you do what you need to do to get the client the outcome, but make sure that you're incorporating these different things. So education, career, life, personal, parenting, and family, right? So we increased our focus on our relationships and meaningful engagement. We set some expectations not only for our staff. So we have contract managers that oversee our local providers that we contract with. And so we set some expectations. We really looked at the way we did contract management, and we said we want to be able to facilitate the relationships. And what does that look like, right? And with that came, some growing pains, right? Some learning pains. And we learned that there were some inconsistencies in the way that our contract management worked and the way that we communicated locally. And so we put in some communication pathways. We essentially laid out, there's some monthly meetings that will take place. What does engagement look like, and outcomes achievement? What does it actually mean? Like defining it for our staff, right? Because we were heavily compliance drivenly and heavily focused on eligibility, we weren't often talking about outcomes achievements or economic mobility for families. And then the one thing I would say is, like, we were like, let's not let perfect get in the way of us doing good, right? We're only and the reality is, there's actually nothing that's actually really perfect, and there's no perfect system. So let's just figure it out. And creating a space where our providers felt comfortable with working with us to figure it out. So I think one of the biggest shifts we made too was really to work more collaboratively across our local offices, our providers, and our DTA employment and training team. Did I miss anything, Miranda?
No, that was great, Tyrese. And I just wanted to kind of connect the dots a little bit with, some of the things that we heard from our folks in Kentucky, as well as, this kind of cultural change and bringing on, frontline staff in the local offices and working in collaboration with providers to really inform the way that the work, would look on the ground has been key. And so, I think in Kentucky, we've sort of started with some of that engagement to inform, some of the potential changes, structurally in contracts or what have you that might come down the line. And so, just wanted to reiterate how important that piece is to really making this work happen and make sure everyone is on board.
I would add to that one, and Kamaria didn't speak to this, but Kamaria oversees our self-sufficiency specialists, which are our young parent case managers in our field offices. And I think one of the biggest things is that we really redefined their role and what we expected of them, and expanded who we connected with, right? And so we have young parents who are in shelters, and we connected our self-sufficiency specialists with those shelters, and now there are reoccurring meetings that happen that allow for a space for our workers and for the local providers to really be able to communicate about the needs of our clients.
Great. Thank you, Tyrese. And so I think with the next section, I think what we'll do is kind of bring us together a bit and shift to another question that we kind of had for both of you, which is really thinking about the ways in which your agency is working to ensure TANF programs are resulting in equitable outcomes for participants. And, I think one thing that might be great to hear from Kamaria, and this was a question we actually had in the chat box too, is, one of the things you mentioned was enabling, smaller providers or non-traditional providers to engage in the program, and just kind of giving some examples of what that has looked like, and then also some of the other strategies that you've used.
Sure. So one example is ROCA. ROCA is an agency. I know they're here in Massachusetts. I believe they're in Maryland. I'm not sure if they're in other places as well, but they engage with high-risk men. Most of them are gang involved, and they do a lot of street level, intense engagement. They always tell us, if you have somebody who is ready and willing and able to participate, they are not the client for them. They are looking for folks who are not interested in engaging, and their work has historically been around young men, but they've recently expanded into young mothers. And so they work in some of our highest risk areas in Massachusetts, So they do very individualized work. I mean, they have access to a training program, but the families that they're working with, it's mostly Black and Latinx families. They work with a lot of undocumented immigrants, and they're doing really intense work with those folks. Another program that we have is More Than Words. So More Than Words is a program that we have here in Massachusetts that's really a social enterprise. So the folks that come in there, they essentially work for, it's a large bookstore. Anybody can go online, buy books from More Than Words. But it's a large bookstore, and the young parents come in there, they are trained, they have like a whole t-shirt system essentially about like, you get a different color t-shirt as you kind of advance through their training. And then they're providing them with supportive services on the side, but they're working essentially. They're getting a stipend. But again, these are more high-risk folks, more folks who are really interested in employment and earning money, but are also getting supportive services and training along the side of that. So those are two of the examples of kind of the non-traditional programs that we have. As far as the other work that we're doing in equitable outcomes, part of our strategic goals and our management goals for the year is to do kind of a cross-program assessment to see how we are doing in the equity of our outcomes and how we are doing with the access to our programs. We just recently hired a program effectiveness manager on our team, which has increased our capacity to look at some of these things. So I think we'll know more about what we need to do to ensure equitable outcomes and access once we complete that, but that's a high priority for us this year.
Yeah, that's great, Kamari. I think that data piece is key, and I know that's something that Jason and Aaron in Kentucky are also thinking about a lot. So I'll give them a minute to talk about their approach there.
Yeah, the disaggregating data is something that I've thought about. I left the agency in 2017, and it's really been something. During that interim time, I was a healthcare advocate, so I was looking at the programs from the outside to the inside, and one of the things I realized both right before I left and while I was an advocate was that we don't utilize the data that we already have. We have this data. We've collected this data for decades and decades, right? Either because it was federally required or to meet a civil rights, type of requirement, which is great. But what have we done with the data? And what are we doing with the data now? We're still not, we're starting to do that process of disaggregating. I was saying just the other day, I said, we need to know what the racial breakdown is of the state. We need to know what the racial breakdown is of our clients who receive services. And then we need to be able to use that and look at outcomes from different policies, different other procedures that we have, and see where the disproportional impacts are. And I think we're just, we're at the beginning stages of that. When you look at the systems of change of how to become an anti-racist organization, that's the first step, is looking at the data and disaggregating the data. The data that we've already received back from our Kentucky Stats partner is disaggregated by race and ethnicity, and sex too, so we can see disproportionate impacts across our much less common male parents. We still have them, but they're not as common, but we still have them, and we want to see what kinds of interventions work for males instead of females, or we want to take a broad approach to disaggregation and making sure we're serving each group the way they need to be served. So that's a big step. And I think Miranda wanted me to talk a little bit about our Building Back Better plan. We've had this, there's a pandemic. I don't know if you know. So our agency is putting together, our new commissioner is great. She's having us put together a Build Back Better plan. We're going to name it something else because Joe Biden stole the name. But there's 5 pillars to that plan. excuse me, number one is racial equity and economic stability. Number two is trauma and resilience, building that both with our participants and our staff. Number three is a focus on health, including mental health and SUD treatment. Number four is a focus on families and children and foster care. And number five is just kind of a broad operational pillar that supports all of these things. This work, we're already, seeing where it fits into those pillars. Primarily it fits into pillar one, that's racial equity and economic stability. But you can argue that this work will touch almost all of those pillars, really. When we look at how this program can be a primary prevention method or mechanism for bad outcomes in the child welfare and foster care system, we want to help families out before they get to a breaking point. So, it falls in with so many of those pillars. We're going to make sure that what we're doing with this project is woven into that Building Back Together plan.
And I'd like to talk a little about the Kentucky Stats work.
Mm-hmm.
I think when you're tackling, issues of racial equity, social justice, the first step is admitting that us as a government agency, we have a lot of room for improvement. The first step that I saw was 4 years ago when we had our new computer system. On our old computer system, our client base was forced to pick one race. And as we know, that just is not a real world. That doesn't apply to real people. And it's honestly kind of offensive. So when we started our new computer system in 2016, we had a lot more choices as far as how someone can identify themselves. And so I think just the ability to, looking from a data aspect, the ability to collect data, I would say 2016 on is really our benchmark. Now, as far as Kentucky Stats, going one step further, I'm speaking specifically of our DCBS data, food stamps, Medicaid, cash assistance, child care assistance. Kentucky Stats is able to take many other branches of government. For example, the Kentucky Department of Education. They're able to link, based on someone's identifying information like social security numbers, link the children, parents, et cetera, up. And so if something was missing in our data, they might be able to link that person to another piece of data that we have and build a profile as far as so we can actually have some real statistics, honestly, sometimes for the first time. And again, I think just admitting that we have a long way to go and we're in the beginning stages is the first step of tackling many issues. Ensuring remote changes don't disproportionately affect our participants. We need to address technology barriers in our rural areas of Kentucky. We also need to acknowledge that, our participants in Louisville, Kentucky have a much different perspective than someone on the other side of the state as far as urban versus rural areas. We are all dealing with a lot of issues and it's, it all needs to be addressed. So.
Yeah, thank you, Erin, for outlining those details. I think, there's so much here, and I think what I'll do is I'll just hop us to a kind of a final reflection here. I know we're a few minutes past time, but I think we've heard a lot of really important themes around centering whole family needs, really thinking about flexibility and case management as really core to working with young parents and TANF agencies, thinking about data disaggregation. And, I know there were some questions around what data we're talking about as far as outcomes. And so we can definitely if folks want to reach out via email, we can definitely, share some of the specific outcomes that we've been focused on for both DTA as well as DFS. But really the key here being the disaggregation by race and ethnicity driving the strategy. And then really thinking about ensuring agency alignment and bringing along frontline staff and all levels of stakeholders in this work to really make sure that there's buy-in and that everyone's on the same page here. And I think, these kind of communication pieces and using data and really engaging really focusedly with young parents is even more important in the current context. And we're working virtually, we're trying to engage people. There's going to be different strategies, and I think these two agencies are finding some innovative ways, and I think would be really willing to kind of continue conversations if folks are kind of curious about learning more. So I think with that, I'll turn it back to Mary to wrap us up, and then I think we can call it.
All right, folks, thanks for hanging in there with us. I know that we're a little over time. I just want to highlight for you that we have the first session in this series is available, and these slides will be sent out along with a link to this video as well. So if you'd like to watch the first presentation, you're welcome to, and you are also welcome to attend our next presentation, which will kind of take us full circle, working on insights from community action agencies, so taking it back to the provider perspective. Our contact information and the contact information of all of the speakers is here today. So although we weren't able to get to the question and answer section, if there is something that you would like to discuss or know more about, please feel free to reach out to any of us. Thank you so much again for attending today. Have a wonderful afternoon.
Thanks, everybody. Bye.
Thanks.